This is Speaking of Pets podcast, where we offer you up-to-date, science-based, accurate information.
Oh, Gizmo!
Good kitty. You're such a good kitty.
And they're looking up and howling in unison.
If it affects pets, we'll talk about it. The Speaking of Pets podcast is sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. And Vetramax Veterinary Supply. Vetramax makes it better. Hey Janet, I have a wonderful guest today. Who do you go to when your dog is limping or has osteoarthritis? Well, Dr. Julie Letosky, who runs Up and Running Canine Rehabilitation. She is a certified canine rehabilitation practitioner, as well as certified in acupuncture and involved in the International Veterinary Academy of Pain Management. So she is an angel because she relieves our pets' pain. Now, whether they have bone or joint problems, whether they have osteoarthritis, whether they're limping because they've had a cruciate tear and they're going to have surgery, or have had surgery, and she can enhance the improvement. We are so fortunate to have her today, and I can't wait to ask her some of the non-surgical options that she employs, be it supplements or laser, to give our animals some relief when they're in pain. So, welcome,
That's
Dr.
great.
Letosky.
Well, and it's hard because as a pet owner, you don't know when your pet's in pain.
Right, and their lives are so short anyway. Who wants them to be in pain for 1 minute?
Yeah.
Yeah.
And having been through a lot of physical therapy,
I was thinking of you about that.
and when you're in PT as a human, it's kind of like you're married to your physical therapist because you're going 3-4 times a week. You're talking.
You know what? I bet they don't give you treats. I bet Dr. Letosky's practice gives treats.
No, they give you a sheet of what to do, and if you don't do it, they like they yell at you.
That's
So,
right. That's right. Get
So
down
I
and give me 20. Right.
that's right. You didn't do your work this week, did you? You know, they can tell. So it'll be interesting to hear what she has to say, like how they know when the pets are in pain. So this is really cool.
You know, when I see people walking elderly dogs, first of all, I love old dogs. You know, I just love that. But then when I see they're limping, and I think, oh, please, there's got to be something that
Yeah.
can help that pet. And also, we want to ask Dr. Letosky what some of the adverse effects of some of those pain medications might be, and maybe she has other remedies that she could recommend in lieu of that.
Well, I want to ask her about cryotherapy because you know I love it.
Well, you know, that's a good question. I know LeBron does that. And of course, Dr. Biggie would know that. She's his neighbor, if you recall. Dr.
Yes,
Biggie.
that's
But I'm not sure we do that yet for pets. We'll have to
because they
ask.
make a wand, a cold wand.
Oh, okay. That's
You
not
don't have to
sitting
go
up
in
to
the
here. Okay.
You don't have to go in the tank, but and you'd have to put booties like on the dog,
Well, that would be extra cute.
Snoopy themed, right?
Little muffler. Yeah.
Because that's because when you go in that tank thing,
Yes.
they put these super thick mittens and shoes, like they're like slipper shoes on you, and then no metal, and you're in a robe.
What if you've had a titanium hip replacement?
I think because the body heat keeps it warm.
I mean, you can't go in that.
No, I think you could because it's internal.
Oh, okay.
It's external metal would get super cold because by about a minute and a half, and they put you in for 3 minutes the first time, you're like, okay, I'm done. And they're like, no, you got to do it. You got to do it. And you turn around in a circle.
You should
Like
take vodka in there with you because aren't you supposed to keep vodka in the freezer?
Yeah. Get a little straw.
Anyway, Janet, let's welcome Dr. Julie Letosky
Yay.
with Up and Running Canine Rehabilitation. We have so many questions for you, Dr. Letosky, because we think you're our little angel to take our pets' pain away.
Oh, well, I appreciate that. It has become the latter half of my career's life's work at this point.
So how did you get to this point?
So it was a little roundabout. So I had been in private practice at the same clinic for about 25 years. And prior to that, we saw a large need for rehab in general, just rehab services around 2009. the clinic started doing a lot more orthopedic work, and we saw rehab as a up and coming service that looked like we were going to need to be involved with. So I volunteered to be trained at that point. I went to the University of Tennessee and came out in 2011 with the rehab certification, and with another colleague opened up and running at that point. And initially it was mostly for our own patients. And then as time passed, rehab became certified or became a board certification in 2018. And from there, it really kind of took off. There was a lot more to it than just rehab. It became integrative services. It became the place for chronic pain management. So I had my own kind of health issues around 2018 that led me on kind of a different healthcare journey. And I realized that what I had been trained for could be expanded upon to work with chronic pain in animals. And so I took about a year and a half hiatus to kind of take care of some of that stuff. And then I came back and I took over the rehab proper again. And I've been working since 2020 on reshaping it into one of the, a more progressive option of rehab, and having everything chronic fall under that umbrella.
So, how many of these kind of rehab centers are there, like in the United States? Can you find them in any major city?
So I would say the bigger the city, the more likely, right?
Yep.
So Chicago was kind of the birthplace of a lot of the techniques that we use. And, the big coastal cities will have, a lot of rehab. And in Northeast Ohio, to my knowledge, to the extent that we offer, there's probably two of us.
Oh, wow.
Jeez.
Yeah.
Wow.
So
And when we ran into each other at Bark in the Park, boy, you had a long line of people wanting to talk to you. And I thought, this must be pretty good. But anyway, talk to us. I know you do laser therapy, right?
oh, for sure.
Yeah.
Yeah, laser's been around for a while. Laser, or the proper name is actually photobiomodulation. So,
But no one can
um,
say that, Julie, so we just
no,
say
so we
laser.
just
And
say
laser sounds
laser.
very Jetson, right? Yeah.
Right, right. So, um, it's been around for a long time. Some of the first lasers were used on human patients for diabetic heel ulcers that wouldn't heal. So, and then they became useful for, um, other toenail issues and things that that human medicine started using it for. Um, we primarily use it to help relieve some, more direct pain, pain that is, well, the caveat to using lasers, you got to know what to point it at. So, it's not like taking a medication, like a nonsteroidal that's going to grab, pain in the areas that are needing it. So it requires a good physical exam to discover where the animal's hurting. It can treat soft tissue pain. It can treat joint pain, and it does that by activating the cell at the level of the mitochondria and increasing metabolic rate, which has a whole cascade of goodness that comes from that, including um, increased capillary blood flow, which is going to, help bring healing parameters to the area and help drain, products of inflammation away. So,
How long does that take? They go for like weekly or like a half hour, or what's the
so,
timing on that?
you get a little flexibility with all the stuff that we offer, especially acupuncture. But a lot of these things are cumulative therapies. So, you're doing them, most of the time, 2 or 3 times a week for, 6 to 7 sessions. And by then you're usually seeing a good response. And then the maintenance on it is backing down to the number of times per month that they need to keep comfortable. And a severely arthritic dog, you may have to come in once a week. But, most dogs land somewhere around twice a month.
So how do you know? Everyone asks me this. How do you know when your dog's in pain?
I would argue they alter their behavior. So especially chronic pain. I mean, acute pain, most people get, they tear something, they break something, there's going to be some vocalization. But with chronic pain, it's usually a slow onset. So they're very slowly changing their behavior. They're adapting to their pain. They're choosing not to go up on the furniture. They're choosing not to jump in the car. They're choosing to lay in areas they don't normally lay. They no longer start picking up toys. So sometimes those are the first signs that pain is a problem. And then, of course, I oftentimes have people say, well, I don't think he's in pain just because he's got this limp, but I don't think he's in pain. The limp is pain. I mean, that is their quintessential way of showing that it hurts, is that they're going to limp on it. But there's a lot of other pain, like chronic back pain or just osteoarthritis, that shows up not in as much of a limp as it is just a slow rise, slow getting started, and then overdoing it.
Mm-hmm. It's got to be so rewarding for you when you see an elderly osteoarthritic patient come in, kind of just hobble on in. Of course, they're usually overweight, and I'm sure you address that. And then after these sessions, like 6-8 week sessions, you hear that, hey, he's playing with his toy again. That's got to be so heartwarming for you.
Well, it is. It's why we keep doing this. We do get a lot of good feedback, and the more I, stay up on the most current techniques, the better and better we get at providing treatments that are way more effective. I am closer to my practice years, with Dr. Jerome, and than I am to a lot of the colleagues that I have now. And, I remember back in the day, we didn't even have access to Rimadyl, which is, like a standard of care at this point, and it absolutely makes me shudder to think of, how we let animals be, and how orthopedic issues were reasons why an animal would have to be, euthanized because they're too big to, carry in and out of the house. And there just wasn't anything available. So in terms of that satisfaction, from where I started practice to what I'm doing now is absolutely night and day. And the reward is, amazing. My motto there is no dog will die of an orthopedic issue on my watch.
Oh.
As a veterinary dermatologist, I can tell you that the chronically affected allergic pet condition, also known as atopic dermatitis, is rarely ever cured, but it can be effectively managed. Command Deep Cleansing Shampoo from Vetramax is a top veterinarian prescribed treatment for skin problems resulting from chronic itch, pyoderma, and allergic dermatitis.
I like to use what my veterinarian tells me to use, which is Command Shampoo by Vetramax. It's super gentle on the skin and tough on that nasty unwanted bacteria. Libby smells great, she looks great, and she loves it.
Vetramax makes practicing veterinary medicine better by giving doctors high-performing, high-value, evidence-based products. Now, with Command Shampoo, you can bring that same quality into your regular home routine. Go to Chewy.com and enter promo code COMMAND15 to save 15% off on Vetramax Command Deep Cleansing Shampoo. That's code COMMAND15 at Chewy.com for 15% off. Vetramax makes it better. Hey everyone, don't forget to pick up Country Critter Journal if you live in Northeast Ohio. It's a must-read for all pet lovers. Their goal is similar to ours here at the podcast, to educate the community on taking care of pets. They're advocates for adopting from shelters, not puppy mills, and they connect our local communities with goods, services, kennels, and those seeking to adopt a pet. They're a hometown paper with a personal touch. A must-read for all pet lovers, Country Critter Journal.
So I bring my pet in and say they're diagnosed with arthritis. So what happens next?
Well, it kind of depends on how is your dog diagnosed with arthritis. I get referral patients coming in from a variety of different hospitals in the area, and the owners will come in and say, we've been dealing with this arthritis for, X amount of time. And my dog's just either they've crested to what they can, how much better they can feel on some oral medication, or, they're getting worse. And I often find myself needing to, take a look at the dog again from ground zero and, do the myofascial exam, range and touch and measure each joint. And then make sure I've got current x-rays, because what I feel has to correlate with what it looks like on x-ray. You can get pain in and around a joint that can be very arthritic. It can be infectious. It can be polyarthritis. And all those things are inflammatory, but they're not necessarily looking like osteoarthritis on an x-ray. So I have to make sure that my x-ray goes along with what I'm feeling, how I'm seeing the dog gait, what the clinical history is. So then if I am satisfied that my patient has osteoarthritis, there are kind of different recommendations for each joint. Most osteoarthritis in the knee of a dog is going to be there because of chronic cruciate disease. So then that's a whole nother conversation. Most other osteoarthritis is due to developmental conditions. Obviously, something that is like coronoid disease or something that happened in the joint as part of, the dog developing. And my elbows are always the hardest joint to treat, just hands down. And it's always knees before hips. So if I have somebody come in saying, we've been dealing with hip arthritis or hip dysplasia, I'm going to make sure it's not knees, because it's the rule of thumb is knees before hips. So, we look at everything with the patient. So, I do a myofascial exam, and a lot of people don't have their dog's fascia checked, right? So you go to the surgeon and they're manipulating the joints and taking some x-rays. But what has happened to this animal compensating for pain for so long, and everything is connected by fascia, and fascia is that spider webbing that goes through everything, carries your immune system, carries your, some cells, carries, fluids. So the fascia is really important. So I need to know, what other areas of soft tissue, muscle, tendon, what's hurting as a result of this compensation. So when I put together a rehab plan, I'm addressing everything that is restricting this dog or is making them feel uncomfortable, so that when we recommend treatments for osteoarthritis, that we're going to get better results and have a better outcome. So that, so then we start breaking down what are my most life limiting issues here, and how do we, what kind of a patient do we have? Are they are they pretty happy to be there, or are they scared half out of their minds? What one's gonna adapt to physical handling, and oftentimes it's controlling their pain better, fixing their fascia, and then getting them on some kind of a strengthening program.
Do you have the owners do any rehab at home?
Yeah.
Or don't you trust it because it might be they're doing the wrong thing?
Well, it's not even a matter of trusting an owner, because a lot of times I get owners in that are that are really good with their dogs. I
Yeah.
mean,
Yeah.
They wouldn't
they're
be
on,
there if they didn't care. That's true.
right. They're on board.
Yeah.
They're there wanting to know what they can do. And I love to have owners participate in almost everything that we do, except for joint injections and that kind of thing. In terms of the water therapies that we offer and the therapeutic exercise that we offer, if you can get the owner involved, well, as you guys know, some dogs do better without their owner. That's just always going to happen. But for the most part, getting the owners involved. But what we learned over time is that teaching a dog how to do therapeutic exercise is a real talent. It's a real um, artistic skill that you develop over time.
I can't
And
imagine how you do that.
Yeah,
right,
like, lift your paw up 10
Yeah, I
times.
mean, no, I
right,
want to
right.
do this, but
Yeah,
you
look in
have
the
to do
mirror and
this.
see if
Yeah.
you're bending your elbow right.
Yeah.
So you have to be really creative. And I've got two technicians, they're registered technicians that also have been certified in rehab, who are absolutely phenomenal at getting these dogs to do these exercises. We use a lot of treats, a lot of rewards, a lot of encouragement. I mean, the dogs that are food motivated are like rehab rock stars, because they just, they're falling over themselves just trying to get the treat. But it's a learning curve. It's definitely a learning curve. And some dogs get it a little easier than others. The ones that get it, and we can kind of help learn a program, and if the owners are coming, we can oftentimes pass that off to the owner. A lot of the equipment that we use is very doable at home. You can swap it for things that are typical around the house. And it's it can be carried out that way. We have an online program too that we can do virtual plans for people that want to do that at home. But I will, and the online program is very thorough. It gives you a written explanation. It shows you a video of how it's done. You can link with them and watch how they're doing things and comment about their progress. But at the end of the day, having a one-on-one, or, you know, helping this dog do them correctly, or watching the owner do the exercises, and making sure that we're not going to get the dog in trouble by, hurting it somehow. And so it became a therapeutic exercise was one of the last things we got really good at, because it's hard.
Yeah.
I
It's a
can't
hard
even
thing to do
imagine.
correctly.
I can't imagine on a cat. I mean, trying to get a
Mhm.
cat to do anything.
Yeah. So, we do rehab cats. We've had cats in the treadmill before, in the underwater treadmill.
Really?
In
Yeah,
the
they look,
water?
Do that?
yeah,
I mean,
they,
aren't they afraid of water? No?
well, most certainly, yes. But every once in a while, you get a real easygoing cat that doesn't mind being put in the water. Most of the time, for me, I'm doing acupuncture on cats. Cats are very acupuncture responsive, and they you hit points on them and they just calm right down. So it's a very good pain, physical medicine pain um, offering for cats, for
Is
sure.
is that acupuncture with the needles or with the laser? Because aren't
Well,
there?
that's a good question. So cats are also very laser responsive, which is a really nice treatment option for them, because nobody's touching them or manipulating them. Laser, they don't really feel. It's done, the way our laser is. It's done 6 inches away from the patient, so you're basically shining the beam on them, but you're not touching them with it. So that's one way to do laser. But there's laser acupuncture as well. There's a little tool that comes on the end of a handheld piece that you can just touch them with. Um, and you're still activating a point. I don't feel like it's as beneficial as the actual needles, but I will tell you that the cats are pretty okay with a lot of the needle use. And I've even done e-stim acupuncture on cats, which is where I hook it up to the little, they look like, people joke that I'm going to jump their car, because they look like little car jumper
Yeah, yeah,
cables.
yeah.
Yeah. And, I turn on different frequencies of electricity through those needles, and
Yeah.
they don't seem to even mind that much.
Wow.
Well, so
Janet,
Julie,
I bet you wish you knew her when you had your knee problem.
I know. Well, I have my PMR. So there's
Yeah.
water therapy, there's laser, you do stem cells as well.
Do you? Well, I don't know that she does.
So me personally, I don't. One of the other doctors got involved with stem cells, and that um, it turns out that the use of stem cells in PRP, which is platelet-rich plasma, is very specific, and there are certain conditions that probably that would be considered gold standard. Yet there are so many other things that we can do. It's considered gold standard, but it's quite invasive because you're typically collecting the stem cells from the fat of the omentum of the
And then
abdomen.
you've got to prepare them a special way.
Yeah, right.
Yeah.
And it's so the expense is really up there.
Yeah.
Yeah.
So I feel like I have chosen treatment modalities that are accessible, effective, affordable. So there's laser or photobiomodulation. There's acupuncture, and I'm trained not in Chinese acupuncture. I'm trained in evidence-based acupuncture. So we use a lot of similar points, clearly, but I think about acupuncture in more of a neuroanatomical way as opposed to um, energy flow and things like that. I look at the anatomy more and the fascial planes and the things that you can interact with, the biochemical cascade of events that happens. So that's how I think about acupuncture. It's a very pain-centered, rehab-centered, you know, um, Western thought process.
Hmm.
Yeah, you
Um,
can't exactly ask a dog or cat to visualize release.
Well, no, not at all. But I will say what is great about a dog or a cat patient is that, they either get better or they don't. They don't think they get better. So you're
Oh,
either
true placebo effect. You're
right.
right.
You're either, noticing that
Yes.
this
Wow.
animal is doing something completely different, or you're just not. And,
Yeah.
each one of these treatment modalities has, a fairly high success rate, but there are times when the one that you pick just isn't, the one that is going to work best for this dog. And owners will tell me, when you did acupuncture, they felt a lot better, but this new thing that you're recommending, we didn't get the same reaction. So, some of it's trial and error. Um, we do a lot of shockwave now too, and I brought in shockwave to deal with tendon issues. Tendons are really tough in dogs and cats because if it's a person, you're resting that tendon in order to get it to heal. But in a dog, how are you going to do that? Right? Good luck. If you immobilize the one arm or leg that has a tendon issue, then they wreck the other three
Yeah.
while
That's
while
right.
they're waiting for that one to heal. So, you kind of have to find ways to deal with tendons. And shockwave it's called extracorporeal shockwave, and it's a back in the, oh gosh, I think 80s is when they started using it for people, and they use it to break up stones. It was a whole urinary tract thing, and it was very focused shockwave. And then, of course, horses get everything orthopedic done on them first because, a horse that's not able to walk is not a live horse. They're very dependent on their legs. So, um, they started doing shockwave in joints and tendons and things like that in horses. And then they made a piece of equipment that was more applicable to the companion animal world, and that's the one I'm using now. It's called PulseVet. There are two types. There's one that's a hydraulic, and there's one that's a crystal-based shock generated. And they're both pretty good. I think the hydraulic one has been around longer. There's a little bit more research on it. But basically, it throws a huge sound wave into the soft tissue. So, sound travels through water better than light does. So it gets deeper and activates or squishes the cells a little bit better than the laser. And when you squish a cell, you get all sorts of, again, I mean, I could get into, anti-inflammatory cytokines and, stem cell release and things like that. But you basically get just a bunch of goodies getting released from what your own body has to offer, that come back and do a fair amount of repair.
That's so cool. That is
Yeah.
so cool. You know, one of the questions that one of the viewers sent in, Dr. Letosky, and I had talked to you about this at Bark in the Park, and you gave me such an excellent explanation, is the new monoclonal antibody injection for osteoarthritis. And if you look on Facebook, there's a whole page of owners complaining about it, but you explained it to me how it's used, and if it's not used correctly, then you do have a treatment failure.
Oh,
Would
for
you
sure.
go over that?
Sure. Um,
Is it
you know,
Librella? Librella?
it's Librella. Yeah.
Librella. Okay.
Librella, right? Choosing your patient correctly for Librella is everything.
Okay.
So, Librella is very specific for the treatment of osteoarthritis. And like I alluded to earlier, there are many things that look like rear leg weakness. There are many things that cause a limp. And you can't just lump every dog into a dog that has probably got arthritis somewhere. So let's just give them this because it's convenient. Um, Librella is nerve growth factor. It's a monoclonal antibody that binds to the receptor that accepts nerve growth factor, and so it's blocks nerve growth factor basically. So you need nerve growth factor for acute spinal cord injuries and for chronic neurologic cases, anything with intervertebral disc disease, gulp, like, geriatric onset laryngeal paralysis paresis, any other kind of neuropathy that comes from an endocrine issue, diabetic neuropathy, the list goes on. All those animals are going to come in looking weak and stumbling and not able to use their legs well. And even if I've got comorbidity with osteoarthritis, I'm not going to use Librella because, I don't want to block that nerve growth factor. You need nerve growth factor in those neurologic cases for them to either continue to be functional or to heal. And if you're blocking that, you could potentially make that patient much worse. So I've removed the use of Librella in some of the patients that I've seen come in, and I've refocused the treatment more on, direct joint, specific treatments. And that's kind of my new thing that that almost every dog that comes in, with osteoarthritis is going to get the recommendation for is a joint injection.
Mm-hmm. Which is?
Oh, so I use a variety of things in joints. Once we assess the joint on physical exam and on x-ray, and depending on if I think, like a cruciate ligament is involved, I'm going to be mixing various things into those joint injections. So they're done under sedation. Mm-hmm. And, of course, cortisone is used. Cortisone mm-hmm. is a great product. I had one in my knee a couple of weeks ago.
Janet, too.
Yeah.
In there.
Yay. But we have the benefit of using, we use hyaluronic acid as well. We combine the two, and then I add in Arthramid, which is polyacrylamide gel. There are a couple of products out there kind of like it, but the Arthramid has been really, really successful in my hands. Does it
make the joint move smoother? It sounds like a gel would do that.
Yeah, so this gel is interesting in that it bioscaffolds into the joint capsule. So over a 2 to 4 week period, it will actually it will be completely out of the joint space and completely incorporated first into the first layer of the synovium and then into the second layer of the synovium. So the end result is that little blood vessels will grow through this gel scaffolding that happens. And so that's neovascularization that causes new blood growth. And then it lines the inside of that new kind of a rubbery scaffolding with new synoviocytes. So these new cells are going to be producing better quality joint fluid. They're going to be causing a biocushioning effect, and you're going to get more elasticity to the joint capsule. So when you have a dog that has pretty advanced arthritis and they're not able to bend the joint all the way, as a matter of fact, elbows are some of the worst joints. They get maybe 50% of what they should. A lot of that is because they have just such a fibrotic joint capsule. And so this can help create a joint that is a little bit more flexible. And the opposite being true too. If I'm treating conservatively a partial cruciate tear or a cruciate tear that for some reason is just not able to go to surgery, it will help that joint capsule firm up or be a little bit more flexible, so that that slide that you get from an unstable knee is not chronically causing synovitis in there. So it's going to kind of maybe slow the process of arthritis as well.
Boy, I know
What
some
about-
humans that would like that.
Yes, I'm thinking the same thing. You know,
Okay.
Janet, I'm thinking two things. Police, I bet she sees a lot of police dogs. And my second question is, what do you have an oral supplement that you recommend? Or aren't you a believer in glucosamine chondroitin and, you know, all those things that we've
Yeah.
what's
So-
the new one? Unnatured collagen. That's the newest one.
Yeah.
Denatured, unnatured.
Denatured.
Hey, by
or
the way, I
unnatured.
use hyaluronic acid topically as well.
Okay,
For
thank
sure,
you.
So I got 3 questions to answer here. The first one is
Police dogs.
I don't see very many police dogs, got to be honest with you.
Wow.
All right.
Interesting.
Yeah, not yet. Maybe
Interesting.
at some point in the future. I think, if you're going to put your dog back out to do police work, it better have a TPLO on that knee.
Yeah.
If it's tearing
Yeah.
a cruciate, right?
Yeah.
So, human use. So, Arthramid is approved for use in humans in this country under the name of Bulkamid. And Bulkamid is a soft tissue augmentation product. So, they use it for stress incontinence in women. They'll inject it into the urethra.
Janet, write that down.
I am.
You're getting up there.
They'll use it for defects like in the face and that to contour.
Oh.
So it's been used for a long time. Then it went to horses, then it went to dogs, and it's used in Europe under the name Arthrosamid.
Oh.
And now it's you would know more about the FDA process, but it's going through another FDA process to be approved for use in human knees. So don't think that I'm not thinking about a little European medical vacation here coming up for this year, And
With
if I
an
were
empty suitcase.
right in an empty suitcase, can somebody please put this in my knee? So,
Yeah, right.
yeah. But it'll be available for us, and it will
Wow.
become standard of care for people over here.
Cool.
And, right. And then the third question was
The oral.
the oral. So when you look at all the stuff that's out there orally, you have to rank it as, high level of evidence, medium level of evidence, and
Buyer beware. Yeah.
low level of evidence, right?
Yeah.
And really the things that are high level of evidence are few and far between. Probably the number one thing is going to be some kind of omega-3. That has the highest level of evidence. And having said that, dogs don't digest the plant sources of omega. They only digest marine sources. So a good quality fish oil doesn't even have to be a dog one, but it can be a human one, but it's got to be free of contaminants, and it's got to be high quality marine fish oil. Even green lip mussel is touted as a source of, glucosamine or whatever, but it's really better just from the fish oil perspective that comes out of that, because it's a marine source of omega-3. So that one is my highest level of evidence. Then you've got a whole bunch of them that fit into kind of a medium level of evidence, and that's going to be your collagens and your eggshell membrane and a couple other things. Then you've got your low level of evidence. And with glucosamine chondroitin, the problem there is its bioavailability to the dog. So in vitro, that's in the lab, right?
Yeah.
in in
I
vitro.
always get those mixed up too, but
I
yeah,
know,
you're
right?
right. In vitro in the
In
lab. Yeah.
in
I thought
vitro.
in vitro meant like
Yeah,
in
right.
the
Okay.
dish, in
There's
the
in
dish,
vivo,
right?
in vitro, right? No, yeah, in the petri dish in the lab, right?
Yeah.
Yeah.
So, when you bathe the joint in glucosamine chondroitin, there are some effects that are good, but you take it as an oral and expecting it to arrive to the joints in any level of concentration that's effective is not really happening in the dog.
What about turmeric, Janet? Because you were taking turmeric,
It didn't work.
curcumin.
Yeah,
There's a bioavailability problem with that too.
And
there's
you
a
have to take
total
it has to have black pepper or something in
right.
it to be
It's a
absorbed.
total bioavailability problem to the dog. Um, oh, what else is out there?
CBD. What
CBD.
about that,
All
Julie?
right. So CBD, I feel, has a pretty high level of evidence. We routinely, as our continuing education changes over time, there are a lot more. There's a lot more information and a lot more studies coming about CBD products, and there's a guy by the name of Dr. Gaynor who kind of has authored one of the more complete books on cannabis medicine in veterinary medicine. And so I've spoken with him personally, and I've read a bunch of his um, you know writings on cannabis medicine, and it's looking like it has a lot of benefits. Now, having said that, you know, the caveat there is you've got to source that stuff well. All right. And there are only two places currently that I feel comfortable recommending to my clients. And one of them is called Peak Therapeutics, and it's out of Colorado. And that is Dr. Gaynor's private business. And then the other one is Elevet coming from Cornell.
I've read their
So,
studies too. Yeah. Dr.
yeah.
Washlock. Yes.
Okay. Yep. Yep.
Yeah.
Hmm.
So, I feel like as a general pain reliever, you're going to get some dogs that are going to be feeling better on that. And again, I think it is a little bit better at targeting nerve type pain. But having said that, you have a lot of little nerves that run through the fascia too. So dogs that have this real fascial discomfort, I guess you would call it maybe like a fibromyalgia type discomfort. I feel like they do pretty well on the CBD products. I like them for older dogs that also have like old dog anxiety, like the really high anxiety. I feel like it's just a nice taking the edge off kind of a thing. So, so yeah, I like CBD. I think it's a good part of chronic pain management.
Hey, did you know that Blue Buffalo makes prescription diets that are formulated by animal nutritionists and veterinarians? And they're used for dietary needs such as kidney support, gastrointestinal support, weight management, and our favorite, allergy and skin problems.
They make a food allergic diet that's an alligator based called NP or a hydrolyzed salmon based for dogs and cats called HF.
So please ask your veterinarian about Blue Buffalo prescription diets.
I get so many questions from pet parents about what is safe and effective to use when cleaning their pet's ears. Dermazoo's Glycozoo Odic is great to use as a maintenance cleaner to keep the ears smooth and healthy. Glycozoo Odic solution has boric acid, which is antibacterial and anti-yeast, glycolic acid, which keeps the skin smooth and supple, and ceramide for routine ear cleaning with a solution that's safe, effective, and repairs skin cells. Ask your veterinarian about Dermazoo's Glycozoo Odic. Let's keep those ears healthy and infection-free. Janet, in your neck of the woods, because Janet had Lyme and Bartonella, so when you get a dog with joint issues that come in, are they already worked up for tick-borne disease, or do you do it?
So, well, that's kind of my story as well. That is why I took some time off in 2018.
Oh, wow.
Uh-oh, Lyme sisters.
Lyme
Yeah.
sisters. What did you
Yeah.
have? Lyme and what else?
Bartonella and Babesia.
You had Babesia. That's
Oh
like
my
awful.
gosh.
So
Yeah,
you-
I got called by the Lorain County Health Department on that one.
Janet,
That's a tough one.
you thought you were bad, Janet, with the two. She's had three.
they say the average number of people or doctors that people see is like 20 before they get an appropriate diagnosis. So most of it becomes quite chronic by then. And then, there's this whole controversy about, do you have post-Lyme syndrome, or do you have actually a chronic form of the infection? And, so I've learned a whole lot about, what Lyme disease is and what Bartonella is in people. And of course, as a veterinarian, they're like, well, it probably came from the same tick, but you probably have some on top of it from all the times you've been, clawed up to bleeding, right? So, it was a journey. I had to have a port in, and I had to have IV antibiotics, and the whole thing. And so I had a lot of time to reflect on what my next move was going to be after I got through this, right? And it's a long-term proposition, because you never really 100% get rid of that sucker, because
You don't.
it
It
becomes
hides in your
dormant.
immunity. Yes.
Yeah, it becomes dormant. It hides in the tissues that don't get a really good blood supply.
How many doctors did you go to before you found one that believed it could be Lyme?
And did you have joint pain?
Yes.
Yeah.
So that is the knee that will likely have to be replaced at some point. The knees are one of the most common joints in people.
Right.
I had finger joint pain. I had just random muscle pain.
Janet, you couldn't sleep at night, remember?
Yeah.
I couldn't sleep, and
couldn't
then
sleep,
I
couldn't
watched
focus.
movies that I now watch again, and my husband will say, "Well, you already saw that," and I'm like, "I don't remember." Like
I
it was
started-
like,
Right. I started to not remember
yeah.
to do my notes at work.
Ooh.
When Dr. Breitschwert has in Galaxy Diagnostics, they have a weekly blog, and so many people, like with endocarditis or
Yeah.
children that got all of a sudden schizophrenic and aggressive, they have isolated tick-borne disease from them.
Yeah, absolutely.
And
They-
I can't believe the human medical profession doesn't look
No,
at that
no.
more.
Mm-mm.
Well, we practice crisis medicine, let's
Yes.
No,
be
that's
honest.
true.
If you're having a heart attack or a stroke, you're in the right place.
Yeah.
But, chronic illness and things that you aren't able to unequivocally prove with testing. And it's a catch-22, because you can't get better testing unless you can get the NIH to fund research into better testing.
Yep.
And they won't approve it because you can't prove right off the bat
Right.
that what you want to research is a direct human health threat. Yet
Yep.
many, many people have called Lyme a silent epidemic.
Mm-hmm.
I believe it.
So
Well, and also with Bartonella, where Dr. Breitschwert's lab comes in, Galaxy, if you're dealing with a lab that only tests for one species of Bartonella and it comes back negative, you could have the other species but say, oh, you don't have it because that lab doesn't test for it.
Right.
no, true.
So that's
It's-
why I love his lab, because every day they're publishing something new on different species that they're finding literally in all over the world that are then brought to this country.
Oh, for sure.
And so I managed it, and it was incredibly painful for 3 years. It just kind of let up last December. And I managed it with Advil as needed, and that wasn't easy. But I swear by...
Well, and antibiotics, they gave you that.
Well, they did the antibiotics, but I had the PMR for 3 years. But cryotherapy, that tank, that was life-changing.
Yeah, for sure, right?
It was, I can't explain it. Like, I was relieved of pain for probably about 48 hours after that. And you get like a high because,
Right.
the endorphins or whatever. But I was going to ask you that. Do you use that on pets? Because they do make a cold wand, a
So-
cryotherapy wand.
Yeah, I haven't, and we don't typically. It's hard enough to ask a dog to get into a warm thing of water, let alone a cold
Or a
one.
needle,
Yeah.
Yeah.
But I will say that one of the things that came out of some of the treatment options that I had taken advantage of was HBOT or hyperbaric.
Oh.
So, I went to Brook Park Hyperbaric, and I did my 40 hours with them, and that was
Heaven.
life-changing for me. That was very, very effective.
Mm-hmm.
And so I actually purchased my own hyperbaric. So I have hyperbaric in my house.
Yeah,
I'm
we're
coming
coming over.
Well,
Next
I
time we're
was
in
this
town.
close. My husband thought I was out of my mind. I was ready to buy one of those big metal tubs to put in the yard
She was going to
with
do
Yeah.
it.
cold water. I was like a nutcase
Yeah.
because you just want relief, but I didn't want to, do the intense medicine.
Right, right, for sure. And I had the cortisone injection in my knee, and I had systemic side effects for a week, and I thought I was going to die. They're so horrible. For me, I look like somebody blowtorched my face. But so I wouldn't want to be put on cortisone either. But to kind of bring back to how I ended up doing this for my own patients is that term that people think means like you hold hands and sing kumbaya. It is holistic, right? Holistic medicine means looking at the entire person and not excluding any theories that might be causing this that could link all this stuff together. I can't tell you how many times I've had a dog present for rear leg weakness and have it turn out to be something completely non-orthopedic. The last one was a dog that not only developed rear leg weakness, but started to develop front leg weakness. And, I happen to be an ultrasonographer as well. So I tend to use what my skills are. And I said, let me just look at your dog's neck. And sure enough, the dog had a big parathyroid tumor. And then I took some blood, and the dog's calcium was like 16. So this dog had weakness from hypercalcemia from a parathyroid tumor, was not an orthopedic issue at all. Now,
And someone would have given that dog Librela, and
exactly.
it would have died of kidney failure from the hypercalcemia.
Right.
Oh my
Oh,
God.
and what did they want to give me? What was that called? The one I didn't take the drug. It would have made the lime. The lime would have fed off of that.
Oh yeah, it would have been like woohoo!
Yeah,
Your
would have had a
immune system.
cocktail party in there.
Yeah, we're stopping your immune system altogether. Now we can
Yeah.
just,
Julie, you are right. And that kind of drives me nuts because you go to, I don't think there's any doctor, any human in medicine that looks totally at the whole being. I mean, when I was seeing derm cases, people would say to me, boy, I wish you were my regular vet. And I thought, I can't do that because it'll piss off general practitioners. But because, like I'd find an eye ulcer, or I was filling in at a local hospital, and the dog came in for Apoquel, and it had a huge mast cell tumor on the back of its leg that it was licking. It wasn't licking because it was allergic. It's licking because
Right.
it had a cancer that
Yeah.
made it itch.
Yeah.
So
Right.
it's so gratifying when someone will look at you, total you,
Well,
but it's few and far between.
and I felt really uneasy at first, kind of stepping on anybody's toes, right?
Sure.
But
You got to
these
get over
days-
that. It's all
these
about the
days-
patient.
right? It's the patient, and
Yeah.
and honestly, post COVID,
Yeah.
anymore, there isn't a private practitioner out there that is going to argue with me if I want to do something more for that dog.
Yeah.
Right.
They're most of the time pretty grateful.
Well, and now with corporate owning most of them, they're so busy. It's in and out, in and out. They appreciate someone
Absolutely.
who spends the extra time,
Right.
and like you send them back to their regular vet. I send them back to their regular vets. I don't need any more clients. I've already got,
Right.
you know what I mean? I just
Right.
want to get the ones I have totally copacetic. Yeah.
Right. So I ended up doing, some internal medicine type stuff. As a matter of fact, they offered a Canine Rehab Institute is who I do a lot of my training with, and they offered a really interesting CE event last January that was, advanced and complicated cases in rehab, which were a lot of the internal medicine ones that were, you're looking at the whole patient, and it's how is their comorbidity or their disease affecting their pain level or their orthopedic needs, and how do you manage all that. And if they weren't offering it in like nowhere Alaska with sled dogs, I would have gone. But
Yeah.
Yeah.
there was a day that I was adventurous and liked to be out in the cold, but it is not now. I told the president of CRI, I'm like, because she was saying, why didn't you come? I'm like, put it in the Cayman Islands and I'm there.
I know.
You got me.
Yeah.
I'll be
Well,
there.
bring me an umbrella drink.
We just had our World Congress, our 10th World Congress of Veterinary Dermatology in Boston, and Janet's in Connecticut, so she took the train up. We had a fabulous weekend.
Boston's a great city. I
It
We
love
had
was.
a great
And-
time. We did the duck boat.
We
Oh,
had
nice.
fun. Yeah.
Yeah. So I'm a holistic practitioner. I'm an integrative
Great.
practitioner.
Yep.
I am a rehab practitioner, and sometimes I still get, stuck in the weeds with some difficult internal medicine stuff. And I still do the ultrasound over at the clinic as well.
Oh, that's cool.
So, Julie, what's the most rewarding thing about your work?
Taking it down a notch in terms of slowing it down. Slowing it down has just made me a better diagnostician, has increased my physical exam skills that are, I remember when I was first a veterinarian and somebody palpated a cat and said I could feel kidneys. And I'm like, I can't. I can't feel any kidneys. It just feels like a big dough ball in there. But now I can feel really subtle things. It slows it down and I get a chance to interact with this patient in a fear-free environment. We have big beds that they lay on, and we take an hour. My consults are an hour long. We get
Janet,
the
we need to
history.
go. I'm telling you. They got the
We get
beds.
the history.
He's got the chamber.
We
It's
get
like a
the
spa.
right
You do the
and
little.
right, and if I'm looking for pain and I'm looking for dysfunction, I'm getting way better feedback from these animals when they're in an environment that isn't, they're just, like this the whole time and they're not going to tell you what hurts. So unless you crank on it, and I don't want to do that. There's very subtle stuff that dogs will do. So what's most rewarding is being able to get to a diagnosis or a treatment plan that is more thorough, more interactive, and that you get to see these patients very, very frequently, because rehab, by just by it being a physical medicine place, is that you're going to see them frequently. And sometimes it's a hard thing for people to do, but sometimes it's just really rewarding for the owners as well. So it's the client connection, the owner connection. It's the group that I work with. I don't have 150 employees. I have 6 employees that I work with, and we finish each other's sentences.
Yep.
So
That's
it's
great.
right.
It's like a family.
Right. It's continuity of care.
Yeah.
It's length of time I can spend, and it's providing a service that I think is way underutilized and not often known about.
And
That's
it's
fantastic.
and it's darn refreshing to hear this. It really is. And this is how veterinary medicine used to be and should be. And I think we're losing some of that. And it's so refreshing that you and your staff just love what you do, and look at the help you're doing.
Yeah.
This month.
That's
Yeah.
incredible.
It is. It's being able to help something when a lot of the other treatments that they've tried have failed. Like, I always feel like I've got something else in my back pocket to offer them.
Julie, this has been. I hope we can stay in touch, because I'm
Yeah.
telling you, I learned so much today.
Me
I have such a
too.
great respect for what you do.
Oh,
And
well, I
Janet,
appreciate it.
now that you two are tick sisters,
Sick sister. And I never had a bite. I mean, we never found
No,
that
I
you
never
knew of.
found it either. But
it. That I
say
knew. They
listen,
ask you that 100 times, though.
well,
Yeah.
the nymph is the size of a poppy seed, and you
Yep.
will
Yeah.
never see that sucker, and it's way more virulent than an adult.
Well, and I am like a nutcase now. I have clothing that's treated
Yeah.
with permethrin when I garden.
Yeah.
I'm crazy. But I have one more question for Dr.
Yes.
Julie.
Okay.
What is your pet peeve?
People that don't pick up their dog shit,
Yeah, I'm with you. Or leave the bag.
right?
Or leave the bag. I don't care if it's
What does that mean?
biodegradable. I'm still going to step
Right?
on that thing.
I know.
No.
You
But
know,
that's a good one.
when I walk the lake here in the spring with the dog, you should, after the snow's melted, I don't know
Oh.
if they think that you're not going to see it because of the snow. There are so
Oh.
many melting piles. And I'm thinking,
Yeah.
this is all going into the groundwater. My dog is stepping on this.
Yep.
This is horrible.
there's a whole host of things, from leaving your parasites behind to
Yeah.
spreading some viruses to again, groundwater contamination.
Yeah.
That's a good
to
one.
algae blooms in Erie, Lake Erie.
Yeah.
So
Ooh.
yeah, pick up your dog crap. Pick it up. Do you know that there's a company out called Thanabiotic, and it's a postbiotic for people. So you've got prebiotics,
Probiotic and
probiotics, and postbiotics, right? So it's like a fecal transplant, but it is oral. So you're basically you're taking a shit pill, right?
in a capsule, right?
In a capsule, but it's UV treated, so it's
Right.
not, but when they advertise for people who are super poopers. So are you a super pooper, right?
Oh my gosh.
Right, and it's people with excellent biome. So I mean, one of the things that Lyme or Bartonella more does is it wrecks your GI
Microbiome.
peristalsis, right?
So
And your
do they
microbiome.
pay for super pooper
Yes.
donation?
They pay for super poopers.
They pay like $500 a poop.
A new income for you, Janet.
I know, but I don't think I'm a super pooper. 'Cause mine's
You
like
may not be.
tainted.
You may not be a good super pooper.
I think our mine's tainted.
You're tainted.
By the way-
Tainted goods.
I've looked into it, and I'm really good at poop samples.
Oh, trust me, been there. Yeah.
Well, I guess we better wrap it up.
No,
No pun intended.
No pun intended. Julie, it's been a pleasure. Thank you
Oh
so
my
much.
gosh, it's been
We
so much
appreciate
fun.
the good work you do.
All
Thank
right.
you.
Well, let me know if there's any way I can help down the road again.
So we can't thank Julie Letosky, Dr. Letosky, enough. She is involved and the founder of Up and Running Canine Rehabilitation. Give her a call. We'll have her info at the end of the podcast. Janet, I think we should sign off. So this is Dr. Alice Novotny-Jeroman and
Janet Novotny King, the Cleveland sisters, saying thank you for listening. We appreciate you. And don't forget to like and follow.
bye-bye.
Bye.
All right. Bye.
Thanks for tuning in today. We hope you learned some valuable information about making decisions about your pet's health.
And don't forget to follow us on social media and subscribe on podcasts, because we love to have those likes. Thanks so much for listening.
That's actually really good.
Oh,
you
good.
could both go bye-bye.
Bye-bye.
Well, yeah.
How about woof woof?
This episode of Speaking of Pets podcast was sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. And Vetramax Veterinary Supply. Vetramax makes it better.
Follow us on social at Speaking of Pets and listen wherever you get your podcasts.
The Speaking of Pets podcast is an SLA video production.